Good afternoon, everyone. Welcome to GRICS Forum. My name is Michiko Izuka, and I'm a professor of the National Graduate Institute for Policy Studies, GRICS. I specialize in science, technology, and innovation policy, and will be serving as a moderator today. GRICS Forum aims at informing policy debates by inviting leaders in various fields. It is a public event, and at the same time, gives out the student opportunities to join and benefit from the lectures and discussions. Today's seminar is titled Antimicrobial Resistance, a Slow Pandemic and Global Call for Action, a decade of progress and future directions. Antimicrobial resistance, AMR, may not be a familiar topic to many of you at GRIPS, but it is one of the most pressing global challenges we face today. From late 2019 to around 2023, we all experienced the COVID-19 pandemic, which raised our awareness of how deeply our lives depend on robust healthcare systems and availability of essential medical products. Antimicrobials are the cornerstone of modern medicine, saving millions of lives worldwide. These medicines are used to treat a wide range of infections, from minor ailment to life-threatening conditions in both human and animals. They are also critical in supporting surgeries and modern cancer treatments. However, when microorganisms become resistant to these drugs, treatment becomes less effective, leading to greater harm to humans, animals, and environment. The spread of resistant organisms creates a serious public health threat over the years. This is why AMR is often referred to as slow pandemic, but the threat may not be as slow as we think, given the potential shortage of new effective drugs. This shortage is largely due to the lack of commercial incentives for investment in drug discovery, as well as the limited training of critical human resources and research funding necessary for advancing research and development in this field. Many experts believe we are at the critical juncture and must act quickly to avoid a potential health crisis. In fact, this year's United Nations General Assembly had taken up this issue of AMR as one of the urgent topics for discussion at the global level. GRIPS, partnering with the Institute of Development Studies in UK, is launching an AMR fellowship program focusing on policy issues. This program is funded by the Great Britain Sasaka Foundation, and it honors two global leaders in the fight against AMR, Dame Sally Davis of UK and Mr. Yasuhisa Shiozaki of Japan, who is our esteemed speaker today. This initiative, a collaboration between UK and Japan, is led by Professor Chris Dawson from Warwick University, a recognized expert in the field of AMR. Starting in January next year, two selected fellows will come to GRIPS for training and research, and we are pleased to announce that they are joining us online today as panelists. We're especially honored to have with us also Mr. Shiozaki, and it is very privileged to have you with us at the GRIPS Forum today. Now, let me introduce our speaker today, Mr. Shiozaki. Mr. Shiozaki is a former member of National Diet of Japan for 28 years, and former Chief Cabinet Secretary, former Minister of Health, Labor and Welfare of Japan. He has been a member of Global Leaders Group on Antimicrobial Resistance since 2020. He's also serving as Global Goodwill Ambassador of Coalition for Epidemic Preparedness Innovations, CEPI, since 2022, and Chairman of Committee for Domestic Production of Active Pharmaceutical Ingredients of beta-lactam antibiotics. Prior to his transition to politics, he had worked at the Bank of Japan. He graduated from University of Tokyo, and he has a master's degree in public administration from John F. Kennedy School of Government at Harvard University. We'll have a talk by Mr. Shiozaki for 30 minutes. Afterwards, we'll turn to panel discussion. And And then afterwards, we'll open the QR session for wider audience. So please send in your question to the QR section of the Zoom. And now I would like to give a floor to Mr. Shiozaki. So Mr. Shiozaki, the floor is yours.
Thank you very much, Izuka Sensei, and I'm very honored to be part of GRIP's forum today on AMR, especially my long friend, Professor Ota, who is the president of GRIPS, is serving as the president, and I'm very privileged to have a chance to talk about AMR and what it's all about. And nicely explained by Izuka Sensei about what is AMR already. I think I would shorten the time of presentation by expressing the bottom line message of my presentation today in 3 points. One is, like climate change, there are global challenges that require the collaboration of the entire world. That means an issue that must be solved globally. The second point is, among these challenges, some have been overlooked despite their importance. A typical example is AMR. Antibiotics are among humans' greatest discoveries, as we see it later on, and form the foundation of modern medicines, just as Izuka Sensei explained, an indispensable component of modern medicine. However, we are now at risk of losing this foundation by shrinking pipeline of new antibiotics. The third point is, although scientists have recognized this issue for decades, appropriate measures were not taken. But finally, over the past 10 years, political efforts have brought this issue to the forefront, creating momentum for global action. And one of them is the Independent Panel for Evidence for Action that was unanimously decided at the UN General Assembly high-level meeting in September this year. This is the second high-level meeting on AMR, and as a scientific approach to future AMR challenges. And this is something similar to IPCC in climate change, and we will explain it. I will explain it later on. And the issue is, from now on, what kind of scope this independent panel will cover, and what is going to be the advices to each individual country and also global community on fight against AMR, both politically and scientifically. So I would like to share the can you see it? Okay. All right. Today I have prepared rather too many sheets of slides, but we will go over it. So these are the what I will talk about. As I said, the antibiotics or antimicrobials or penicillin, they are definitely the greatest invention of humanity for the past, well, the human history, I guess. And there are a couple of 10 biggest inventions of the world. Each has penicillin or antimicrobials somewhere among top 10 inventions. And as Yasuhisa and I said, the antimicrobials are the foundation of modern medicine. And without antimicrobials, infection, it's not just infection treatment, but also it's about cancer, chemotherapy, or any surgery of any kind. And also, for example, dialysis. In the case of dialysis, you have to give antimicrobials to the patients in order to fight against decreasing immunity. And the resistance issue or problem was already warned by the Nobel Prize winner, the Alexander Fleming, in his speech of Nobel Prize acceptance speech in 1945. It says, there is the danger that the ignorant man may easily underdose himself, and by exposing his microbes to non-lethal quantities of the drug, make them resistant. So he already warned us that there is going to be a resistance issue in future. And in 2014, David Cameron, Prime Minister of Britain, said we are in danger of going back to the dark ages of medicine, and to see infections that were treatable not be treatable, and we will see many thousands of people potentially die from these infections. And Lancet's piece in 2022 released the number of 1.27 million deaths directly attributable to AMR, and associated with AMR, the number goes up to 4.95. And if you compare this number with other diseases like HIV, at least AMR, death caused by AMR is bigger than the total amount of HIV/AIDS and malaria. And in 2016, the O'Neill report from UK also made a prospect that there is, well, by 2050, the number of deaths attributable to AMR goes up all the way up to almost the same amount, the number of deaths by cancer of 10 million. And we will go a little bit into how the antimicrobials are used on the globe. This slide tells us that the 70% of consumption of antimicrobials are used in livestock, animals, and 30%, only 30% consumed by humans. And right-hand side, you'll see among the countries that uses the antimicrobials for livestock, China is the #1 consumer, and the US is second, and Brazil third, and so on. But what the important message is, it's not just human beings that consume antibiotics. And this is the figure of Japan, and this is the same, 30%, about 30% on humans, and 10% for agriculture, and the rest, the animals, for 60%. And AMR is a complex threat requiring One Health response that tells us that there are many ways to use the antibiotics, and it's not simple to solve this issue. In the case of human, of course, it's used for treatment, but in animal, treatment and control, disease prevention, growth promotion, and kill germs or insects. And in environment, we'll see the remaining of antibiotics go through the environment, but the transmission mechanism is not clear yet. So we have to look at the humankind and health of human and health of animal and also health of environment. This is what we call One Health approach. This is the environmental water contamination and pollution landscape of the globe. Last year, UNEP released a first report on AMR, and I think UNEP is going to be one of the centers of the science that would explain what is AMR and what should be done to overcome this issue, the problems of AMR. So, as I explained, AMR must be solved in One Health approach because it's very complex and serious issue facing human beings. And it's a top global public health threat. And problem is, we often misuse and overuse of antimicrobials on human, animals, and plants that goes into the environment. And but we have to remember that AMR affects, especially any region and any income levels, but low and middle income countries are most affected. That's the problem. And gains of modern medicine at risk, as I said, and antibiotics pipeline and access crisis we will look into later on more detail, but pipeline is shrinking. And also the global south is facing the equitable access issue and also financing issue also. Well, this is the number on antibiotic research and development, and you'll see in the past 30 years we don't have any class of antibiotics has been into clinical practice since late 1980s, and because of the market failure that we all face. And this is what Prime Minister Cameron really pointed out as the possibility of going back to dark ages. And this is the case in Japanese market, and the same, the very few number of new antibiotics are listed. But political actions have been taken in the last 10 years or so, and some achievements are now being made, and we have a lot of homeworks to be done in future. Well, and as I said, Prime Minister Cameron pointed out the possibility of going back to the Dark Ages. So did almost the same thing was said by President Obama, and also Chancellor Merkel pointed out in 2015, especially, this is the picture at the WHO Global Health World Health Assembly. And in the same year, the German hosted the G7 meeting in Germany, and also stressed the importance of fight against AMR. And behind these political messages, there is a very important one book that was written by Dame Sally Davis, former Chief Medical Officer of England, and the title, The Drugs Don't Work. And she's still, and probably will be, the leading figure to guide the direction of fight against AMR. And as a result of political action, in 2015, Global Action Plan was adopted, and also One Health approach was also adopted at the World Health Assembly in 2015 in Geneva. And this Global Action Plan, there are keywords, 5 keywords: awareness and surveillance, and reduce the incidence, meaning infection fight, and also optimize the use of, or proper use of, antimicrobials, and also increase investments on new antimicrobials. And then came the G7 summit in Elmo and Berlin Health Ministers G7 meeting, and I hosted 2016 Tokyo meeting of health ministers on antimicrobial resistance in Asia, and also Ise-Shima summit in the same year, and Kobe health ministers meeting, and first UN General Assembly high-level meeting in September of 2016. And as a result of political declaration of high-level meeting in 2016, Interagency Coordination Group, IACG, was established, and that came with a final report in 2019 to set up a global leaders group on antimicrobial resistance. One of the members is Sally Davis, and also I belong to this global leaders group, and from 2020. And this is the Hiroshima summit. It also includes the important message for fight against AMR. And this is the mechanism of R&D financing, assisting the R&D for new antimicrobials with the Carbex and GARP, with the main organizations that helped the new, or the invention of new antibiotics. And also, it says push incentives is covered by Carbex and GARP mainly, and pull incentives. There are 4 countries that already have the system of pull incentives: UK, Sweden, Japan, and France. And in preparation, EU and Italy and Canada. And US, they have the bill, but it has been suspended for some time, and nobody knows what's going to happen to the legislation yet in the United States, although it's a very ambitious scheme as UK, and we are looking forward to positive response of new President Trump. And so our Japan's reaction and our national action plan from 2016, we will see what's in it. This is a global action plan, the 5 pillars, and this is the Japanese action plan from 2016 to 2020. That's the first phase, and we are now in the second phase, starting from 2020 to 2027, elaborating and developing more sophisticated than the first stage in the second stage. And we do have a numerical target as Japan's national action plan by looking at the amount of use of antimicrobials in human. And from the outset of action plan from 2016, and for the first time, this time from 2020, we have the numerical target of amount of use of antimicrobials for animals towards 2027. This is a little bit too specific. As I said, Carbex, GARP, we contribute and help these organizations to global research and development. And I think we have to keep contributing to these organizations in order to have new antimicrobials. And we do have drug price system that encourage the for new antimicrobials, and also appropriate use for reimbursement price incentives for proper use of antimicrobials in the medical services. And so there are many ways to promote the action plan, the fight against AMR, and these are the political policy measures that we are taking, and our students at GRIPS might, when you go back to your countries, you may want to look up these items and whether they are really being implemented or not. This is also stewardship, proper use for, manual for proper use. And surveillance system is very important, both in hospitals and also for livestock. And this is only for hospitals, but we do have surveillance system for consumption of antibiotics, and also the disease of animals. So Future prospects. We do have action plans globally, and more than 90% of countries have developed multi-sectoral national action plans on AMR. But the problem is only a quarter of countries budgeted and financed. That means severely underfunded in most low and middle income countries, which bear the greatest burden of disease. And only half of the countries had effective multi-sectoral coordinating mechanisms to implement national action plans, because for one health policy, we have to coordination among the ministries covering human issues and animal issues and also environment issues. And so we do need coordinating mechanism, but there are only half of the countries that have proper coordinating mechanism. And in many countries, inadequate engagement of animal and plant health, food production, environmental sectors, because there is a grave conflict of interest between use of antibiotics and economic growth. And that really brings us the politics to fight against AMR. And for these conditions given, we created the Global Leaders Group with those members, and supported by quadripartite joint secretariat of WHO and FAO and UNEP, and also World Organization for Animal Health. And advocacy is one of the important global leaders groups' responsibility. And this is one example of a letter from our chairman, the Honorable Mia Mottley of Barbados, the Prime Minister of Barbados. She's a powerful Prime Minister, although it's a country of very small population, but she has a great influence. And this is her speech at Dubai last year at COP28. First meeting of high-level meeting on health, and Health Day was created in the COP, and this is the speech she made, and clearly saying that the AMR is the #1 killer, and it will reserve a century of medical progresses. That means bringing us back to Dark Ages. And Global Leaders Group proposed a policy recommendation of 10 this March towards the member states preparing for the high-level meeting in September this year. And this is the picture of a high-level meeting. And again, Prime Minister Mottley made a good speech, and also WHO Tedros, the Secretary General, also made it clear that again, the only 11% of countries have allocated budgets to implement those plans. That means action plans are not a realistic approach yet. And the political declaration was adopted unanimously, and you can see all these numerical targets and all that. But the most important progress is the high-level meeting, is the creation of independent panel for evidence for action against antimicrobial resistance, which is very similar to IPCC, that it's a body, United Nations body for assessing the science related to climate change. So we are going to have political debate also, but more science must be introduced in order to convince the general public and also the conflicting sectors in order to fight against AMR. Why do I stop here and let Izuka sensei proceed? Thank you very much.